think we should call this meeting to order. It's 7 o'clock, it's a little bit beyond 7:04, so we're ready to start. Dr. Quinn, we have our quorum, so if you want to introduce yourself and we can go around and.
Sure, I'm Melanie Janine, I'm the Public Health Director.
Randy Kring, Board Health Member.
David Ropeek, member.
Jim Whalen, Chair of the Board.
Camila Lombardo, Office Coordinator.
And it looks like we don't have any other of our members on the line, so I don't know if Portia will probably sign in and.
I re-forwarded the link to her again, so she should get that now.
Okay, so I guess our first order of business is the approval of January 21st minutes. I didn't have any changes to them. I read it fine. Did you?
No, I didn't have
any issues? Randy, any issues with them? Okay.
Yep.
So looks like we're looking to approve those minutes.
I would move to approve.
I would second.
Seconds, all in favor? Aye. Okay, so the minutes are approved from our last meeting. So we have the third agenda item is Andre Joseph, Public Health Inspector, and we're gonna have a vote.
Yes.
Okay.
I'd like to introduce Andrea Joseph.
Yay.
Hey,
Andrea is our Public Health Inspector that started with us February 2nd.
oh,
Andrea has taken off in great form, doing training and learning all there is to do to be a Public Health Inspector. She's completed a number of inspections jointly, and we're looking to make her an agent of the Board of Health. Do you want to say hi, Andrea?
Hello, everybody. Nice to meet everyone.
hi, welcome.
Thank you.
So we'll move to vote to appoint her.
Yep, please.
Okay. I vote in favor of appointing her.
I'll second.
Okay,
All third.
excellent. So it looks like we have approval.
Okay.
Welcome aboard.
Thank you.
And if we see you coming to our house, we should clean up our kitchen.
Yeah, for
yes,
sure.
spick and span in this town.
Andrea's
Yeah.
gonna do all the inspections. She's starting her training in food. She'll move on to camps and pools.
Oh, my
And
God.
then she'll do septic and housing and everything else.
Oh, wow.
So,
Yeah.
so she's doing great, moving
Good,
along.
busy, yeah,
Yep.
excellent.
And how does this put the department as far as
It makes us fully staffed.
staff?
Wow, all right, congratulations.
Thank you, that makes me happy.
Yeah, excellent.
Indeed.
Well, again, welcome. All right, moving along to the fourth item on the agenda. Melanie, if you could give us an update on 141 Katarina Heights.
Yes, we had received official documentation of the building review and a septic permit, and we've reviewed and approved the septic permit, so it's fully issued and ready for them to build.
Oh, okay.
Right now, there's 3 feet of snow on the ground, so that's a little bit of a barrier,
Right,
3 feet of a barrier at least.
not impossible, but it makes it more difficult to put frozen when it's cold, to put the soil back in
Yes,
place.
is there frozen ground problems for building, you said earlier too?
It can be, it's not impossible, we've had a few repairs but if it's still, the soil gets frozen and you have to put it back, it doesn't compact if
Yeah.
it's frozen. So it can be a little tricky, not a preferred thing. Obviously we do some that as it gets a little warmer, it's manageable. But I have a timeline. At this point, we will be working with them to make sure they hit that April, like they have a plan for ground. Breaking ground, because there is still quite a bit of a nuisance that complainant would reach out to me and I gave her an update, but I do think that septic system is moving along.
now with the filing of that plan, have we suspended the fine?
Yeah, we suspended the fines as soon as they applied.
Oh, okay,
We just I was wanting them to do the Form C, the official size that they need to, and they're gonna build a sufficiently sized system.
Oh, excellent.
That area is groundwater conservation, so it's 4 bedrooms to an acre, but they have enough land to build the size they want.
Yeah, it's a pretty sizable lot, it looks
Yeah.
like. Okay, excellent, okay. So we have another agenda item, number 5, unless there was anything else we wanted to mention about Catarina Heights.
Nope, I didn't have anything else.
Okay, so we're gonna move along to 18 Nathan Pratt Drive, Unit 106. We have an appeal in front of us tonight. It looks like we have some people representing that appeal. But you know, I think for
Excuse me, Mr. Chairman.
Yes.
Would you want to invite them to come up to the table?
Sure, yes, please, if you'd like to come join us at the table so we can see you. We're going to kind of run this as far as we just want for conservation of time and so that everybody gets a chance to be heard. What we'd like to do is we'll start with Melanie kind of giving us an update on exactly what's in front of us. I think we have to kind of limit everything to time just because we have a few more items in the conservation of time. So we're going to keep all our comments to about 3 minutes. And that should be enough time. You'll get a chance to speak and discuss with us. Yeah, both of you will have 3 minutes to chat. And then we're going to bring it back to the board to kind of discuss at that point. And so at that point, it'll be close to any other further comments, and we'll just discuss amongst the board exactly what the next steps will be. So Melanie, if you wouldn't mind taking us through the appeal and where we're at tonight.
So in the beginning of January, we received a complaint of smoke odors from an occupant at 18 Nathan Pratt Drive. Health Inspector Michael Panioli went out to Nathan Pratt Drive, spoke to the complainant that did not detect any odor or smell at that time. We logged the complaint. We received another email complaint from the complainant. It's in your packet, but then we informed the complainant we can't observe anything. We don't deem it a nuisance. And we said, but if you ever smell it, we'll call us, we'll come back out. And on January 27th, the complainant contacted us, and we went out. And he was able to observe a strong odor of smoke outside of unit number 106. At that same time, the complainant had called the police. So in your paperwork, you see our case notes from the initial, and we've actually switched to a different database. So we have his inspection from 127, the notes, the complainant original email to us, and the police report. We issued an order to correct. We cited nuisance law that we observed, and under Mass General Law, an agent of the Board of Health can observe something and deem it a nuisance. We told them to the occupant of number 106 to cease the nuisance. And the occupant appealed. I reviewed all the paperwork and informed the occupant of their right to a hearing before the Board of Health. I'm going to stand by observations of the inspector that what they saw and smelled was indeed what was going on. So that's my position. Is that we observed the smell of smoke and we'd like ask the occupant to stop doing that.
Okay.
Okay.
An iPhone just joined the chat.
That's Portia.
Portia.
Hi, I'm on. I just didn't want to interrupt. Sorry about that.
No worries.
All right, Portia. Okay. So with that, that's the wrap up of what's been going on, and at this point, we'll start the comments of the public that's present. If you'd like to speak, please do. And excellent. Oh, okay, okay. If you could just.
Down because I knew I'd get nervous.
Oh yeah, no worries. Yeah. If you could just introduce yourself
Oh,
and where you
okay,
live,
yeah.
and then please go.
I'm Tracy Flaherty. I am the tenant resident at 18106. And I'm here today with my complete honesty that I do not smoke in my apartment or in my building. And I had been burning incense. I love incense. It's all part of my rhythm because that's just me. But since hearing that, obviously it's being smelled and not appreciated, being confused or missmelled, whatever. Ever since I found it was a nuisance and perhaps a health risk to others, I've stopped since burning incense. I burned sage in my apartment. I don't know what sage smells like at this point because I've been so nervous. But anything that I've been sent or read, I have just, and again, there's no smoking of anything, it's a burning. But again, and I've stopped using that, the incense and the sage. There will be no longer using either or. If you could see my home, you'd know why I wouldn't smoke in there. It's beautiful. I don't want yellow walls. And it's not the rules. It's against. We have a designated smoking area for to do such things. And that's no, that's it. So I don't really need 5 minutes. I'm just nervous.
No, sure, yeah, yeah, no, I'm glad you were able to speak. If there's anything else you wanted to add in.
I
Okay,
don't know if I wrote anything.
Can I speak as well? May I speak as well?
If you don't go.
I will stay within three minutes.
sure. If you could just introduce yourself and how you're
My
and
name
your
is-
residence.
I'm Cynthia Pierce. I'm a resident of Boxborough. I know Tracy through church. I've known her for about a decade. She called me when this incident happened and I requested the police report and everything. She said that a neighbor had been complaining that she was smoking marijuana, is what they claimed. The police came to her, got a call from the apartment complex management and the police came to the door. The police came to the door, she invited him in to inspect the apartment and smell whatever he wanted to smell. He did not enter the apartment. From the doorway, he told her that he didn't smell anything in the apartment itself. There was a smell in the hallway, but not in the apartment. When he went back and wrote the police report, he reported that there was no smell of marijuana, which was the original complaint. But he did report in his police report that he had smelled cigarette smoke. He then reported that he went upstairs to the complainant to the 206. And apparently there was a meeting, according to the police report, of your inspector and the police and the complainant. And they smelled marijuana smells in the closet of the complainant upstairs. But the inspector never entered Tracy's apartment, never knocked on her door. She invited the police in to inspect and to review the apartment. And nobody came into her apartment. So he smelled the marijuana in 206, but he didn't even come into 106. And Tracy was there the whole time and would have welcomed anybody to come into the home, but nobody came in. I have known Tracy for a decade. I have a key to her apartment. I checked in on her regularly. I don't announce when I'm coming ever. And I have never observed cigarette smoke in that apartment. And I'm extremely sensitive to cigarette smoke. And I mean, I take her trash out. I've never seen butts. I've never observed her smoking. And honestly, if you walk in an apartment, if somebody has been smoking in an apartment, it gets in the drapes, it gets in the towels, it gets in the bedding. I can smell that a mile away. I would invite anyone to drop in unannounced anytime to her apartment.
Can I just interrupt?
And
I
there's
have
not gonna
one
be cigarettes.
further thing to say. I did ask the property manager who's making the accusations to surprise me, unannounced, pop into my building anytime, knock on my door. Don't call in advance. I'd rather him come as a surprise, and there's nothing to hide. If I was to hide something, I'd be like, just a minute, hold on, as I'm spraying Febreze all over my
So,
apartment.
I guess I'm
my
upset
last
that
statement.
she's being accused of smoking her apartment by another tenant in the building. But the inspector hasn't even come into her apartment, and yet this order is making it work. She's gotten letters from the attorney from the apartment now setting up her eviction. It just does not make any sense to me at all. If the inspector had actually come into her apartment or knocked on the door, that would make some sense to me, but it doesn't make any sense to me at all that the inspector didn't even enter her apartment. He smells it upstairs and decides that it's coming from downstairs. That doesn't make sense. It just doesn't pass common sense test. So,
Okay, yes, thank you, thank you. Was there anything else you wanted to add?
Right.
No,
yeah, I don't think there's, I mean, I'm requesting that this order be vacated and that there be something in writing to vacate it because I don't want her losing her housing over, I don't know if it's a disgruntled neighbor. I don't know who the disgruntled party is, but I have never, ever, and I'm over there frequently over the last decade.
all right, well, thank you both for the comments. At this point, we're gonna bring it back over to the board. We're gonna discuss it. No, you guys, you can stay, yeah, you can stay. But we're gonna have you not, at this point, the comments from your, are gonna be closed just so we can discuss. You may hear things, as we deliberate, but, again, at this point, all the public comments are gonna be closed for it, so. Okay. All right, so. I guess initially the concern that I have is that, obviously there's something going on where there was the complaint. I think reviewing the, patrol officer Brendan Fitzgerald. There's one line here, in particular that said, Miss Flaherty invited me to the apartment, and I did not smell any marijuana. I could not smell any marijuana, but I did smell cigarettes throughout the apartment. Now, whether that's cigarettes or incense or I know sage can be kind of pungent smelling throughout the apartment also.
Can I just ask, so
Sure.
what are we, what are our options here as the board? What are we trying to decide about? It sounds like Ms. Flaherty is agreeing to the order that we have, agreeing to that she is not going to smoke or burn incense. And so what is our endpoint of our discussion here?
Yeah. Well, I think it comes down to, compliance with the mass general law, that says that there can't be any burning or whatnot inside, residents. And I think, whether we vacate, this decision, or this finding from our from our, inspector, and I think that's pretty much what we're looking to do is, what they're asking to do is to vacate, or whether the order should stay, or the finding should stay from our inspector. My thing is, just based off of what the police found along with our inspector, kind of backed up the information. So at this point, from my opinion, I don't know what you gentlemen think, and Portia, about not vacating because, at this point, our inspector found basically what the police reported who physically went into the building, or into the apartment, so. I think that's basically what we're looking to do. We just
Do I
have anything to
understand,
clarify?
Melanie, that the order is?
To stop any vape
The
nuisance.
indoor smoking is causing a public health nuisance.
Correct.
Okay, so it's not burning of anything. It's the,
So since we wrote the order, I spoke to the occupant and she has ascertained that she's not smoking. I did communicate with her not in writing, but on the phone, we talked and I said, well, if you're burning incense, if you're not smoking, that is perhaps causing the nuisance.
Mhm.
And I advised her, I did not order her, but I advised her to stop doing that because I think if that's what's being spent, but I don't know, I wasn't there. I'm standing by what the agent observed of the board. The agent went there a number of times, didn't smell anything, went back one time, did smell something. I guess it's a case of what they're saying versus what the police put in their report. It's two different contradicting points of view. Okay, Mike admitted he did not go into the department. He put that in his initial observations are in here, and then I had him write up a more detailed description, but it is after the fact. So the first documents are like what we write as an inspector is our observations, but there was no inspection report. I saw it, we wrote the order letter, we moved on. In my mind, if we ask this person to stop the nuisance and they stop the nuisance, we're not gonna go back and enforce anything. There's no further action from our standpoint if they don't do anything. And I don't know about the content of the letter, and they didn't copy me that, nor was it my business to see what the letter that they received from the property.
To clarify the question that Randy asked, the point of law that we're being asked to judge on is nuisance.
Correct.
Indoor smoking, not burning something.
We cited odor.
Odor. Okay, thank you.
Can I ask a clarifying question, which is, is there a risk of housing loss if we don't vacate the order? I guess I heard a request for vacating the order.
Not,
In which-
I would say that you need to stick with, as a Board of Health, from what I wrote. Because I don't know what, that's different evidence, unless you wanted to, because we told them to stop smoking. So.
Right, but I guess my
believe-
clarifying question is, there was an order, right? I guess I heard an ask about vacating an order because of risk of housing forfeiture. And so I just want to make sure that I'm understanding what the ramification is or what authority we even have to do. If
We don't
there
have
are
any-
implications.
We have no written documentation about that.
We do.
Okay, understood.
And the report, as provided, including Mike's updated comments, would be available to Ms. Flaherty if needed to provide to her apartment complex. You know, if to Yes.
Anything we have
Yes.
is public record.
Great.
Like, everything
Yes.
we have, this memo, everything is public record.
Can be used by any of the parties any which way they want and adjudicating however they want.
Great.
Right, is that what I assume correctly?
Correct.
Yeah. As well as the minutes from this meeting once they're written.
Correct.
Yeah. So I mean, my thought would be, it would be reasonable to say that there is some ambiguity regarding the findings of the inspector and the police officer, and that there's a contradictory report from the resident. Nonetheless, as a Board of Health, we received a complaint of a nuisance. There was evidence that there was a nuisance present. And so I don't think we can, from our representatives with our inspector, as well as the police report. And so I don't think there's grounds to discontinue the order to that.
And I want to correct, I want to make a correction.
Please.
I misspoke. We cited nuisance law, we did cite indoor smoking. That is true. So we cited indoor smoking as causing a public health nuisance. So that is a correction.
Could the order be addended to reflect odor rather than indoor smoking?
As I read your
Yeah,
memo,
or-
Melanie, speaking to your point, Dr. Crane, the issue before the board is not limited to whether the applicant is smoking cigarettes. The nuisance condition stems from persistent smoke odors, whether from cigarettes, cannabis, incense, or another source. We have evidence from the police that those odors existed. The evidence from the police is that they entered the apartment and smelled them.
They never entered the
The police department says they did. pending any change in the circumstances there, the order seems appropriate. Now, you've said, Melanie, that the occupant says they won't anymore.
That is what they've told me, yeah,
And-
and I mean, I think that's the story that they've collaborated here.
So that I would suggest that the board is something to take into account as to whether the order continues or is conditioned upon further behavior or something like that. Because, you know, the nuisance order stands, comma, pending, you know, no further complaints, something like that. The evidence does seem to be that the order was appropriately ordered.
Can I ask a question?
We're gonna have you hold comments just until the end. We just wanna go through the board first, just on the deliberation. While we deliberate. Portia, do you have anything to add?
No, I guess my one point of clarity is just as someone who's been in housing court is I do want to make clear that if we're saying that she violated a no smoking order and that's a breach of her lease, if she was violating a no burning order, I do think we owe it to her to modify the report to indicate it's not been verified that she was smoking, right? I think that that's a distinction that's probably worth making in the record if that has implications for her lease, right? Like, I think there's an understanding that she was burning something and it could potentially have been causing a nuisance, but the terms of her lease probably say no indoor smoking. And I'm not hearing enough compelling evidence to verify that there was indoor smoking. I think we've established that there was indoor burning, and we should correct the record to make that clear.
In the memo from Melanie, the director of Board of Health, the nuisance condition stems from the persistent smoke odors, whether from cigarettes, cannabis, incense, or another source. It makes clear in that language to me, there is no evidence of smoking per se. There's evidence of odor.
That's what when I reviewed, I guess. When I reviewed everybody's perspectives, that's what I felt.
Okay, so
That's not what the order said originally, okay? The order cited smoking, everybody involved at that time. You know, we don't usually collaborate with. When somebody is in violation of nuisance, we don't usually say, do you agree with our observation as an agent of the board? We observe something and we document what we observe. Okay, so at the time the order was written, the agent and the police reported that this was a cigarette smoke. Okay, back and forth about cannabis, and and then we observed, we felt at that time, we observed cigarette smoking. We did not see her smoking, right? There's no cigarette, but that is true. But the evidence showed that there was clear what people perceive to be cigarettes coming from that apartment.
okay, and as I read further, the order specifically does specify this indoor smoking is causing a public health.
Correct, because everybody
That's the
involved,
legal language that
correct,
parties in this matter could use in whichever way they choose. The legal matter is that finding there's been indoor smoking.
correct.
Okay.
And then they appealed.
Yep.
Okay, which is their right, they got an order letter, you have right to appeal, issued an appeal. And the memo I wrote to you is kind of like, this is what I found upon review.
Right, but going now by the legal language.
The legal
that I think
language,
seems actionable for us is the order per se, the order itself. Rather than your memo, which is guidance, but the order now, which, like if I'm a landlord. Right, I waive the order, not your memo. So that's the thing that I'm looking at as what, in my mind, we're being asked to act on.
I'm also wondering if, just with Ms. Flaherty's admission tonight about burning, even though it was inadvertent, it was a burning of incense. And one other item you mentioned, sage. That kind of corroborates that there was smoke in the apartment. which does kind of play into the language of, there can't be any burning in the apartment at all because of this nuisance. So whether it's marijuana, which was not the case, cigarettes, which apparently is not the case, but there is burning going on, then the order should stand based off of that. Of the finding of a smoke substance in the hall or in the apartment.
You could change it to say, to rescind the smoking and call it a nuisance, like in my bottom of my memo. You could say, I believe that my agent and the police observed a smell. Okay? The occupant is alleging or saying that there's not cigarette, everybody else, the complainant, okay, but we're taking that equal face value. One person says one thing, one person says the other, but the agent and the police officer observe that. So I'm going with that, that's what they felt that they smelled. So hence why there was an order to stop smoking. Right? But if you want to change it to order to stop the nuisance of the smell, then you could do that.
I think that seems reasonable to me.
Okay.
I don't believe that there wasn't a nuisance of something going on. Based on the collaboration of multiple and the occupant's conversation with me, I do think, and at least there was a smell that is entering the rest of the complex that is being perceived by other people as marijuana and or tobacco.
And
All
this
I was
order-
gonna say to add to Randy and your comment is, I think we've got an admission that there was a nuisance, right? I think by her own admission, she was burning incense and sage in her apartment, right? And now it's a function of like, how are we interpreting it? And I just don't hear enough, like the fact that the police officer didn't go into the apartment. I just think we need to be clear that we've established that there was a nuisance. We've established that there was burning. We did not establish that there was smoking. And my feeling is that, from what I'm hearing, is that that is a very key distinction for her rights as a tenant. And I just want to make the record clear that we're all in alignment, and the tenant's admitting that she was burning, she stopped the burning. But I don't want to create a record where we say we've corroborated that she was smoking, because that has very real implications.
Correcting one thing, Portia, as I read the documents that have been provided to us, the police did enter the apartment, the inspector did not.
No, the police did not either.
That's not according to the police report.
Sure.
I'm reading the police report.
I think we have to just basically go with the documentation that's presented to us. And in this case, it does say Miss Flaherty invited me into the apartment to see if I smelled any marijuana. At that point, he said I could not smell any marijuana, but could smell the odor of cigarettes throughout the apartment. So that's implied that the officer was throughout the apartment.
She did invite him in, he did not go in, so. Can I ask one question? Can I go back?
We're just gonna hold for just a moment longer.
It also strikes me that since the person that the order's been filed against says, I'll stop, she's meeting the conditions of the order. The order says stop. As of the date of this order, have there been further complaints?
No.
Okay. So we have evidence that the order is being followed,
Correct.
or we have a lack of evidence that the order is not being followed. Right? That the order is being honored. Which to me, my mind means let it stand and it's working.
But
To eliminate the nuisance and resolve the issue.
I think their concern is what Portia's point is. I don't have the written documentation to discuss, is the letter they received from the apartment complex. So I don't know, I don't have that in hand because it's not my responsibility. Like they also received, and I think that's what she wants to talk to you about. But I don't know its content, and I don't know if they said you're gonna have more chances to not smoke again. I don't know what it says. Okay.
Okay, so our order says stop.
Mhm,
And there's no evidence that she's failed to do that.
correct. I don't have any,
So I'm
More
I'm just
complaints. I have
thinking this
nothing-
out loud and I.
I have nothing else saying that they,
I understand that, Melody. So I'm thinking out loud that the landlord can't say. You have failed to meet this order. We have no evidence of that. That can be used against her. And again, I don't know these legalities, but to
Well,
Portia's point, losing housing, you have to be in violation of the order now. For it to be a continuing problem. If the problem has stopped, how would it be, Portia, you might know, used against her? It's a past.
yeah, I think the issue is probably that the lease says it's a zero tolerance policy, and they're gonna use the fact that there was an order establishing smoking as a violation of the lease. I don't know what the lease says about a violation of, like, I have no idea if a tenant is not allowed to burn incense. That I have no idea. But I don't think that we've established that she was smoking in her apartment. And so if they're trying to vacate her lease agreement on the basis that there is evidence that she was smoking, and we're saying, well, the order stands, they're still going to use the order. So we have, if we're going to say with 100% certainty we feel confident that there is evidence of smoking, that's one thing. If we don't feel that there's 100% evidence of smoking, we should correct the record to reflect there was evidence of a nuisance. And we've established that there was a nuisance. But we have not established that she was smoking in violation. And again, we don't want to get into we're not in the business of knowing what her lease agreement is. But I have not heard enough evidence to establish that she was smoking cigarettes or marijuana. And I think that that's an important distinction.
So it would be feasible to, as you mentioned, Melanie, to put an addendum on the order to clarify,
correct.
to make that adjustment. So I would move to do that.
I would second that.
Okay, I think it's probably prudent then to postpone any vote or any finding at this point in time to a later date meeting where we can revisit this with the addended language.
Or can we?
Can we act on asking her to
Yeah.
amend the language and then pursue things further, but have her amend the language, which is what's currently on the table? Amend the language.
You
and
can
then come
vote to
back
amend
to
the
it,
language.
or to vote to not amend the language at all.
I would be in favor of voting to amend the language to just establish that there was a nuisance, but not enough evidence of smoking. I think that's the only thing that we can do or should do.
Agreed.
Okay, let's take a vote on that, then we'll do a formal vote. Why don't we vote at this point to put an addendum on the language? Randy?
I move to approve.
Okay, David?
Approved.
Portia?
Approve.
Okay, I approve at this point to addend the language, and then we'll replace this as another item down the line at another meeting.
If necessary, I mean.
If necessary.
If necessary.
Melanie is our agent to do that, right?
Yes, I will amend the 8 and I will resend it out and to the parties involved, and if they wish to appeal, they can, or, you know, they can appeal.
Sounds good.
Thank you for the information. Yeah, we're gonna revisit this issue at a later date.
But she'll get a copy of the meeting.
I will do the same thing as last time. I will rewrite, or what I'm gonna do is discuss today's vote and finding, and then sign that, and then send it to you. Probably
My
the,
last name is Flower. I think.
yes, we have established that.
Okay.
You tell me that.
Oh, I
And
did.
yeah, you called me up and told me, and I corrected it. I think we just had some old
Okay.
information,
No
so,
problem. I just.
so sorry about that.
No worries.
We'll get it right, don't worry.
Um.
Thank you for
We-
the,
we-
yeah,
oh,
yeah, well,
Thanks for coming. It's not easy for you, so thanks for coming.
yeah, thank you for coming in.
Okay.
All right, so moving on,
Thank you.
Take care.
I guess we're not gonna, we didn't place the bird seed.
So that's not an agenda item, so. I'll talk about it in my report. Let's do the nurse's
Yeah,
report. and then
yeah, I
I'll
wasn't
talk about
sure
it
if
in my
that was
report,
something,
okay?
okay. So we're moving along, next agenda is gonna be the public health nurse report.
Hi everyone, I'm just going to share my screen real quick. All right. Does that look okay?
Yeah, yeah.
Looks
It
good.
looks small to our old eyes, but that's all. It's up.
Okay. All right. So for the January communicable disease report on Maven, we had 46 flu cases, we had 11 COVID cases, 5 Lyme disease cases, and 2 latent TB cases. So we're seeing kind of like that downtrend of the flu cases, and even so less in February that we're seeing that I'll report on in March. For community outreach and education for January, we attended the FEP Region 4AB Emergency Preparedness Tabletop exercise in collaboration with the fire department. We completed and submitted Concord's All Hazards Emergency Preparedness Plan that was in preparation for that tabletop exercise that we submitted. And then we inventoried the Harvey Wheeler Emergency Shelter for preparedness supplies. I took town employees' blood pressure for the heart health event run by the HR department. We're continuing work on the community health improvement plan. We're just kind of finalizing that and we'll be ready to present soon. I also participated in a blood pressure clinic at the COA, which I do monthly, as well as I assisted with preparing the medical portion of camp inspection documents for camp season. That's it.
Are there any plans to take the town employees' blood pressure on the day before and the day after town meeting to see how they compare? Just joking.
That could be interesting. Good idea.
I'm surprised to see Lyme's disease up there as many cases as there
In
are.
the wintertime, yeah.
I wonder how unusual that is.
Or those
Fairly
persistent
unusual.
persistent cases from earlier.
Oh, maybe that's.
They didn't just start.
Yeah,
Maybe.
yeah,
Like the tuberculosis cases, it's been 2 all along, kind of, as I recall.
Yeah.
Right?
Yeah.
They are, might be the same people.
probably the same person.
Those are
Okay,
2 new latent
No.
TB
oh, those are
cases.
all new?
Yeah, those are new.
Okay,
Wow,
thank you.
okay. Very good. All right, so, item number 7, Public Health Director report.
Excellent.
Thank you, King.
Thank you.
And no questions for Katie about, great.
No.
So, it's winter time, so we're doing our winter preparation. We had Andrea start with us, February 2nd, so we've been onboarding and training. Andrea, all the other staff are continuing on with their, getting familiar with their jobs, training, we're almost all old hat at this point, but no, we're still, doing great on that. We did do a mock shelter drill last Friday, like Katie mentioned, with the fire department and other town staff. We had members of the public come and pretend they were seeking a shelter.
Yeah.
The COA supported that, those initiatives. The Concord Bridge came, and interviewed us, and it's all in preparation. And ironically, the 2 days later, we had a snowstorm, and we prepared as a town, we might have to open a shelter. So that's all in kind of updating our emergency preparedness work. It's kind of a good thing to do in February.
There hasn't been whatever, there's some phrase for this, a hot wash or whatever. Post
Station.
Event, how did it go?
We had an internal hot wash, and we have some next steps, to work through. Like, we had a hot wash, we shared the findings with each other, and then we haven't really had, it's been a snowstorm. So we haven't had a chance, between fire and myself and other parties to kind of like circle back. The town is for town staff, gonna have a shelter training in end of March, through FEMA, where we're gonna address this as a town. One of the things that came out, for example, is how would we actually staff that? If you operate a shelter, it's around the clock, and what that would look like. and making sure everybody's knowledgeable. Katie did nursing, Kimberly did intakes and pretended registered. We had people literally leave, and if you had a shelter, you can't just let people leave. We really got to see a good dose of what it would be like to try to stand up a shelter, open the cots, you know, understand that those are pretty uncomfortable to sit on and all that. So that was a good drill. We did some good learning about what to do next time. And our staff here, and then working with our partners across town.
Was there anything that stood out that was deficient that you needed to,
How it would actually operate,
yeah,
like staffing, like if they had called a shelter storm, like I live an hour away
yeah,
in the middle of
in
a
a
storm.
storm?
You know, like I wasn't gonna be able to get here within, you know, it would take
Yeah.
over 2 hours to get here
Probably longer.
and maybe not be safe,
Yeah.
right? So,
Like when to declare it for
Who-
people like you, so that you can get there. in
correct,
time.
so I think there's some opportunity there to really,
Think that through, great,
correct.
awesome.
Correct. Andrea and Mike both been working on some food inspections in Lincoln. Andrea has been, like I mentioned earlier, been doing some of that. And we've been getting ready for camps and pools. So I sent out a letter to all our last year's camp. I'm gonna try to meet with the school department about the camps they have at that campus to make sure everybody has the information, applies in a timely manner. And we have a very high number in Concord. We have last year we had 20,
Yeah.
which most towns have 4 to 6 max
Camps,
of camps, recreational camps for children.
No.
20.
We have, when I tell people we have 20 and we ask,
Like how many?
we asked
how many
Katie,
counts do you have?
we asked Katie they're like, how do you possibly, who has 20 camps? But between the high school campus, our private schools, like Fenn, Middlesex, they all, Concord Academy, they all have summer camp.
Oh, those summer
camp.
things. Oh,
You
right,
know,
of course, there you
Up on Strawberry Hill Road, they have a couple, they all are using and renting out their facilities. So people are coming from all over. And then there's individual camps, you know, in the camp code now. If you're just here a week, you have to have a camp, you have to comply with the same regulations if you had kids all summer long.
Mhm.
And that can be a little bit, I'm not gonna lie, it's cumbersome for people. Like if you're just having a week-long tennis camp here in Concord or soccer camp, and you have to do all the same forms and same paperwork and same training as a camp that would run for 12 or 15 weeks. It can be a lot
go. Yeah.
for the camp operators. We have, the ice all the way as far, the ice rink, they have a camp. Right, on that end of town, all the way through, all the different facilities that are here, so there's quite a few.
Yeah.
So that's kind of a lift between that and the pools. In the spring, and then septic is gonna take off, cause what's happened is we have so much snow. Since I've been here, it usually slows down, but not, like, we do a little bit of deep holes, but there's not too much installation going on. And
It's all gonna come at once.
if they're gonna be like.
So those are like the variances so that their system will be acceptable.
They have to, so in Title V, in order to build a septic system, you have to. Just call the deep hole observation test, you have to dig a hole.
Put some
120
water in it, see what happens.
inches down, see the type of soil, it's called soil profile.
Yeah.
And in with most restrictive layer, you have to do a perk test, so you pour water and see how fast water passes through the soil.
Yeah.
But that's harder to do when it's frozen.
Okay.
Right, not impossible, a bigger excavator can get through the frost. But it's also, if soil sits out and freezes, it's hard for it to go back in the hole, right? So that just, it's not, we don't have a moratorium, some towns say for all of January, February, March. We don't have a moratorium, it's kind of like common sense weather, like we had one scheduled for Tuesday, they canceled. And had it today, because they had to go out and shovel the snow off the ground in order to get to it, right? So there's just some practical implications. Exciting things looking forward, I'm partnering with Economic Vitality, that's Mimi Graney, and offering both choke, CPR and food safety training to the restaurants. So I sent another email out today, don't have a lot of takers yet, Court Booth is gonna give the CPR choke training. And we've hired a vendor to do, not the food safety manager, but basic food safety. Where washing, hand washing, cross contamination for free for any of the food businesses. So I was hoping to get some better participation.
CPR
far-
training for people who work in a
So
restaurant.
in a restaurant, if you have 24 seats or more per mass food code, so 105 CMR 590, you have to have somebody on duty at all times that's choke trained. Not CPR trained, choke,
Honda, kind of,
exactly, that you could be sitting down at a
but
restaurant.
not like the CPR.
Correct, not CPR. And there's actually no standard for choke training, which is one of those cases. So we take CPR, like we accept a CPR course, because why wouldn't we? But you can also, and court does give a certificate to actually specifically focus on choking, and we also would take that. We're not terribly strict. We don't say, have you been audited? But the point is, people are prepared. It expires after 2 years and repetitively trained to, if somebody's choking, what to do.
Joke, okay.
Okay. And then, partnering with our behavioral health collaborative on a couple of projects. The first, Jenny Sicardo from the Emerson Beatty Center, excuse me, is gonna Recreation is gonna host a community health fair. I'm gonna want all of you to participate in that as well. But we're going to first ever try to see if we can get that off the ground with partners from in town and also private sector. So Emerson Hospital, different partners, and we're, substance use recovery programs to talk about community, hoping to maybe have it at Giroux Park, concept to try something like that. So
Looking at the summer or?
Yeah.
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 Sure.
Cool.
So that's
Yeah.
kind of something that we wanted to, as kind of part of our initiatives in behavioral health, to talk about mental health, talk about all the different great things that are going on in this community, to do. So we're gonna try it. And then the last thing I really want to talk about is we have this resource, and Kimberly is, put a lot of time in to work on this with me, to promote our community clinician. So the health division has a contract with Elliott, we supplement, so anybody could get mental health, clinician with, independent of what your insurance covers. Okay, so they do take insurance, but if you don't have it or it doesn't cover it, we pay money so that's not a barrier. But it's not utilized as a resource enough, like we have enough for there to be 25 visits a month, a week. She's gonna get 25 visits. And she's getting about 11. So, we serve anyone between 5 and 105, all ages. We work specifically with the schools. There's one clinician that is 18 and under, and there's another clinician, Laura Page, that's going to be doing 18 and up.
So these would be posted in various places.
All kinds of places. If you want some, I'll print them, I'll laminate them. This green one here is one that the fire department, we met with them. This is
Grab the other.
a new version. The original version had a phone number, and then people were like, we need a QR code, so we did a new version. But to go leave, like when, they go and a rescue call and there's some sort of domestic disturbance or upset people, they can leave this card. It's just like, if you want to get
Thank you.
mental health resources, here's a number to call.
Can I ask?
Yeah.
But we've talked about this before, and this idea just popped into my head. What about mailing this to everybody in town? The letter that we have this resource, summarizing it, not one of these, but necessarily just putting what you just said and stick it in everybody's mailbox. I mean,
I'd have to look, I probably would try to do it with a utility bill, because of the cost.
Yeah, no,
Like, putting somebody in.
yeah,
It's actually really
I'm just
expensive.
thinking about outreach. I'm thinking about reaching.
The message is really expensive.
Yeah.
Yeah, I'm just thinking about how to reach everybody, thinking out.
Okay.
The box. just a suggestion, just a thought to look into and.
That's not, that isn't an approach to do, and it certainly would reach, one thing we've talked quite a bit about is how to reach people. I see Katie left, but she met with Donna McIntosh today. We're going to put an ad in the bridge.
What I was gonna ask.
Yeah, I-
That was-
This one is the one we're gonna put, I don't know, did we?
We've been like emailing back and forth, just figuring out
Like an ad.
pricing,
We're gonna put an ad in the bridge.
Cover at two, right? Yeah.
how long we're gonna leave it up for, the size. We've been contacting them, but we haven't.
How big of an ad
finalized
you wanna?
Yeah,
Yeah.
with that blue ad.
Nice.
Awesome.
Yeah, looks good. Very good.
These are more
Very
designed to go to
good.
coffee shops, like to be like tear off,
Tear
to
off.
cut and tear.
Yeah.
Yeah,
There's some ones that are different visuals.
That's cool.
Yeah, they definitely catch your eye, yeah.
the QR code brings them to the referral link, but the QR codes on the actual flyers brings you to the website. But the referral link is like in green, right at the top.
It says
So they
referral
can-
link, you can click,
yeah.
you should try it. I want-
Yeah.
You don't
gives
have to
them-
click referral, but
A communication thing should always give people something they can do,
Right,
because if they wanna act on it, they can.
Yeah.
And then they're in, and then they have to figure out the clicks, but you've given them the doorway.
right.
we received that feedback from our first round, so I was targeting the end of January, but we had feedback that was, well, we received, and then we, like you said, we did some changes. So that's kind of, we've been working with anyone, and anybody wanna help promote this in Concord, like, you have ideas. Taking all volunteers.
There's a bulletin board at the BD Center and.
Yes.
Could potentially go with that.
Did she post it there yet?
I haven't noticed, but I'll look next time I'm there.
Okay, cause I sent it to her and said, please post, but, she- we also were supposed to talk about this on Monday at our behavioral health collaborative meeting, and we got snowed out, so,
Fair enough, yeah.
maybe I'll mail some to her. These are printed out, I'll put them in inter mail,
No, there you go.
so they're already,
Yeah,
they're already,
Yeah.
thank you.
yeah, looks
Yeah,
good.
she's worked, it's me. Worked hard on them, Kimberly's been
Yeah,
working hard on it.
fantastic.
Every time I have another edit from somebody, she's like, here we go again.
Right, back to the drawing.
Job
board.
security, Kimberly.
Yeah, I have a nice touch with it.
So that's all I had. Is there any questions?
Belknap Street?
Oh, so yes, I forgot about that. So we had a complaint. At. What's the address? Belknap.
110 Belknap.
Yeah, regarding feeding of the birds. And this is an example where we investigated, and we did the opposite way. We found no nuisance. We said, this is not a nuisance.
What was the complaint?
The complaint was that somebody was causing them a nuisance because the neighbor was feeding the birds.
That was
So-
bringing in mice.
Mice and
Rats
caused
and things.
damages to his, he showed us evidence that his car had been damaged and chewed by mice. But it was sufficient distance away, and nobody that looked at it felt that it was proof that it was actually a nuisance. Person was feeding birds on the ground. We sent them a letter that was in the packet that said, hey, we've received a complaint. Could you stop feeding the birds as much as you are? Cause they were pouring a large amount of bird seed on the ground. Person contacted me. I spoke to them on the phone. I explained the situation. They have a neighbor conflict going on. But the occupant gladly said, I'll stop. I am feeding a lot. I agree. And said, I'll keep it. So Mike went out there today, observed, yeah, there's plenty of bird feeding going on. It's in a bird suet feeder, but it's no longer on the ground. And we were not able to observe a nuisance like rats in the vicinity enough for me to say, I didn't see any.
The issue in order.
The issue in order, correct. But the person wanted to appeal and was gonna come, and I said, well, there's no order for you to appeal. But you can come and be heard in public session.
I should have you issue an order against me. We could have bird feeders in the back and they spill on the ground and there's squirrels. And they've taken into habitating underneath our solar panels. And it just cost me $7,000 to rewire the solar panels and put in squirrel proofing because they like the fucking waterproofing.
I would
This
advise
guy's
you,
designed to put on the.
I would advise you to stop feeding the
Yeah.
birds.
Kind of example of you.
Yeah.
But,
terrible,
you know,
terrible.
But
I
yeah,
get it, I get it.
so we have no regulation that says that's against, there are towns that have a boards of health that make a regulation that say you can't feed the birds, but I don't think I'm gonna propose that to you. You could decide to do that, but I don't suggest it.
Usually you see with don't feed the ducks, because it brings in,
Goose shit and everything.
Yeah, brings in-
Complain about that.
Generally speaking, different types of food that people would feed wildlife, like bread, is not healthy for them.
Yeah, corn is not, I don't think.
You know,
healthy
it's
for them
it's
either.
not in their nutritional like diet, and so they can, it's like eating too much candy, right?
Yeah.
It's like, it's not
It kills
good.
deer, I think, if you feed them just corn.
You know how I always bring stuff up at the end when Randy's packing up his computer? You mentioned rinks. Do we do anything with inspecting indoor air quality?
So, no, because the rink uses an electric Zamboni. So the only part, the regulation that is currently on the books for indoor air quality has to do with the emissions from a propane engine and the misfiring of a propane engine.
Terrific. When I was a reporter, I did an investigative series on how rinks didn't have electric Zambonis, and they all do now as a result.
Mhm.
And I wanted to make sure this rink did, because it was one of the rinks that I picked on and showed having really bad indoor air quality. The kids would come out sick and with headaches and stuff. And I didn't know where it stood. I'm glad to hear where it stands.
Yeah, wow,
Right.
good, yeah.
Yeah.
All right, any public comments? I don't know if we have anybody in the public would like to comment now. Okay, so we'll move to adjourn.
I move to adjourn.
Or second, okay?
You obviously.
Aye. Good.